Oh, Cliff! Doctor! You're doing it wrong! It's my turn for the little box. Then what do you worry, dear? Want me to frisk you for it? I'm sure it's in your pants. You just say that because it's true. Are all the sound people happy now? Hello? Have you ever felt like I looked? My name is Nancy Nurse, and I am the cure for bradycardia. You never saw anything like it, did you? Not even from an agency. Pretty close, though. And I have come here today to tell you how you can get to look just like me. What's so funny? I know you don't think I know what I'm talking about, but let me tell you, my IQ is hypertensive. I've been in nursing a long time. You've heard of hypertrophy, haven't you? So stick with it, honey, you can get some too. Now, I would like to tell you how to cut down on the stress in your job. Does anybody out there have stress? The rest of you are on Prozac. To cut down on the stress in your job, first of all, don't breathe through your nose after you punch in. That will help. Second of all, remember, all bleeding ultimately stops. You can trust me on that. And third, never smile when you suction. I learned that one the hard way. Now, I want to tell you how I first began to understand the truth about being a nurse. It all started in nursing school. Was anybody out there ever a student nurse? Yeah. Did you graduate? I didn't. I escaped. Now let me tell you why I had to escape from nursing school. First of all, that's a terrible place to send a sweet young thing. Think back to that moment in your career. You were just a sweet young thing. It was a long, long time ago. Far, far away. And you were standing in some hospital hallway. The moment you recognized the truth, you were standing there with your first load. We're going to get back to this as soon as I turn my microphone on.
You didn't do it right, Doctor. Will we ever get them trained or not? I don't know. You were standing somewhere in some hospital with your first load. I remember that moment. I was looking at it, and it was looking right back at me. And I had no idea where to stick my load. So I had to run up and down the hall until I found my nursing destructor. You had a nursing destructor too, didn't you? But we all survived. I'll never forget that. I found my nursing destructor. She told me I had to find the utility room. I found 2 of them. They looked the same, but they smelled different. So I went into the room that smelled like what I had. I was doing this shift at a VA hospital. Has anybody ever worked at a VA hospital? You spell it V-A. It's the VA spa. Everything inside of a VA hospital is very, 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 very old. So I went into the utility room, and there, built into the wall in this old hospital, was a wonderful silver device. It had a little door that opened up. You remember those, don't you? I knew right away that was where my load was supposed to go. So I put my load in and I closed the door. I saw the instructions, but I didn't want to waste any time reading them. That was my first mistake. Second, I decided to turn all the buttons on the machine. And the little needles were going like that. Steam was coming out. I knew something wonderful was happening. There was one little pedal I had not pushed yet. Did it happen to you too? It's such a surprise. I pushed the pedal and the door flew open. And it was swishing and splashing in my face. Down the front of me. Well, that's one of the first times I learned the truth about nursing. Sometimes you have shitty days. My destructor made me go home. She said I smelled inferior. I'm just losing all my boxes here. I told her I was not smelling inferior, I smelled posterior. Well, that didn't stop me from pursuing my career in nursing. I went home, I took a bath, I washed my uniform. I was ready for him on the second day. First day was all about bedpans. The second day, a bed bath. They gave me a coronary patient. He's not alive anymore. But I gave him a wonderful send-off. I went into his room to do some of my best work. Somebody had put the fence up on his corral. I figure they do that so the patients don't stampede you in the hallway. I knew I couldn't do my best work over the fits. I had to put the fits down. But I failed to notice one thing. Tied onto the fits was his room service button, which is no problem except in a VA hospital. Because in an old VA hospital, if you want everybody to come see what you're doing, you just pull that cord out of the wall. And it's an open invitation. They come running down the hall, honey. Well, as soon as I put that fits down and the cord came out of the wall, it hit all of his get well cards. And his full urinal. It spilled down my leg into my shoe. Just as everybody showed up at the doorway to watch. Boy, was I pissed on. And my instructor would not let me go home. She made me walk around the rest of the day like this. Well, that's when I decided to escape. Soon as I hit the streets, though, I realized I needed some more experience under my belt before I took the state boards. So I went straight to the ICU. Yeah, you know, the expensive scare unit. And now, if you say that word, ICU, it comes out, ICU. Now, there's a reason for that. First of all, you got to realize the people that work in an ICU are weird. Yeah, weird. They take tubes and needles and they stick them into every part of the body. And they drain the juices out. They put a little in the cup and send it to the lab. If you ever work in one of those ICU places, if you ever touch anything, it'll be covered with somebody's snot. So you're always going, ew, ew, ew. And that is why they call it the ICU. I got me a job right away working prime time. You know, 11 to 7. They tried to make me feel a little better. They put my name outside in front of the hospital. It said, appearing nightly in the ICU. I came on duty one night. The evening nurse had done a terrible thing. Terrible. She had pulled the curtains around my little old lady. You're not supposed to pull the curtains around the little old lady after the sun goes down. Yeah, because they have that syndrome, you know, called sundowner syndrome. Means when the sun goes down, the squirrels come out. And the nuts aren't far behind. I pulled the curtain back. There was my little old lady. She is just finishing pulling out the last little bit of her NG tube. She looked. Did you grease this thing or what? Have you ever had one of those shifts? I'm having one now, honey. She was looking at her NG tube. Then she looked at me and she said, "This is the longest piece of snot I have ever had." But she even got more upset and surprised when I told her I had to put it back in again. This nursing business is a tough job, dear. It's a tough job. But I did not come to tell you stories. No, I did not. I want to go over the skills of our profession. I want to make sure you know what you're doing out there. As you can see, I am a clinical nurse. I have a tube for every hole in the body. Has anybody out there ever given an injection? They call them shots, girls. You know, poking holes into people. It's kind of like a cross between acupuncture and pin the tail on the donkey. Now, remember in nursing school they told you? You gotta stick it to them in the upper, outer quadrant. Do you remember that lecture? But they never told you why, did they? I came to tell you why. If you do not stick it to them precisely in the upper, outer quadrant, you pop your patient. Oh, yeah. Oh, yeah. And they fly around the room. Oh, yeah. The hypertensives go real fast. I'm not even going to discuss the constipated ones. That's why they give you so many of them at the beginning of your shift. In case you have a bad shift and you pop a few. You have somebody left over to give report on. So I would like to go over how not to pop your patient. Would anybody like to volunteer that part of their anatomy? I didn't think so. That is okay. I'm going to go straight to the top from my bottom. Oh, Doctor! You could humble thyself a little.
I guess it's too late to ask for mercy, isn't it? Somebody help.
Have you ever had your head examined?
Yes. Yes, and they found nothing.
Nothing.
Wrong.
Wrong. Oh. Please rise. Now tell me, Dr. Cooney. You've blown it a few times in your life.
Yes.
Yes. That's how you ended up in psychiatry.
How I ended up here.
Everybody's got to work, honey. And they would just love to see you blow it again.
Isn't there a friend out there anywhere?
Honey, these are nurses. I can tell you're not a nurse. I'm going to drag this out as long. Now, just a minute, honey. I have to find out. Nurses, would you like to cure jaundice, sunburn, or cyanosis? Cyanosis. I like to keep a tidy unit. Okay, now, honey, you have to start at the end with the hole. You got to be real clear with this type. Because you know what they say. If you can't do it, teach it. Isn't that right, Professor? Go to medical school. Now, you just got to start at the end with the hole. Yeah, just blow it. This is the Art Carney blow job here. Wait. You have to blow out. You can't blow. You have to go. Okay? You have to exhale anyway, so just do it in the bag, dear honey. There you go. Yeah. Do you pass gas like that a lot? Uh-huh. Don't you start with me. Because you know how I get. And honey, I'm armed too. Now, wait a minute here, honey. I think you should let a little bit out. Uh-huh, you're kind of tight, aren't you? Uh-huh.
Yes.
Most doctors are. Yes, a little more, dear. Try to loosen up a little. Pass a little more gas, dear. A little bit more. A little bit more. Let it up. Now say, excuse me.
Excuse me.
Now tell me, Dr. K, have you ever tied one on? Well, you don't have, not today, dear. I know you've been on duty working hard, or hardly working, I don't know. Do you think you could tie one on now? Yeah, that's good. Don't forget to take your finger out. Pretty good, and you're not even a surgeon, huh? Now, you're a doctor. Yes, you had to think about that,
Yes.
didn't you?
Had to check my watch.
Check your watch, yes. Now, would you examine our patient, doctor? That's very good. You observe. Then you palpate. That's very good. And you should always auscultate.
Can't hear a thing.
You're a psychiatrist.
Yes.
I always wonder if you listen anyway. Now, Dr. K, you can see we have some edema.
Yes.
Yes, but it's not
yes.
pitting.
No.
No pitting. Whoop. And we have an umbilical hernia.
Oh, yes.
Is there anything else unusual about our patient?
He's turning blue.
He's turning blue. That's what we call cyanosis.
Goodbye. Oh,
No,
cyanosis, not sayonara.
It's easy to get confused. All right, I'm going to go get my equipment ready. You stay right here with the patient. Now, I brought a number 2 gauge needle so the back row could see. Now, we all have our own injection style. If you're assertive, you're a jabber. If you're meek, you're a bouncer. And if you're persevering, you're a grinder. Now, it don't matter how you stick it to them. And it don't matter what you stick into them. Pharmacy thinks it does, but it isn't. Let me show you now how not to pop your patient. May I have the patient, please? Thank you very much. And honey, I think you better sit down and let the nurses handle this. Give them a big hand, folks. Now, it's very important to prepare your patient for the injection. Always prepare them. It's their favorite part. Then take careful aim at their upper, outer quadrant. Let them have it. Watch carefully how not to pop your patient. There, you see? No difficulty if you know what you're doing. However, if you just stick it to them anywhere, this is what happens. And it's awfully hard to explain to the visitors. What happened to Dad? Does anybody out there need a stress reduction? I have one of my favorite stress reduction devices here, and I want to show it to you at the first signs of stress. Now, I know you are worried about your image. What will people think? You use something like this, it'll make you look younger. Takes years off your life. Do you ever have doctors give you stress? Me too, honey, and they start to smart mouth me. And if it don't work the first hole you stick it in, stick it in another hole. There's a lot of stress in this nursing business. Haven't you noticed? A lot of stress. As soon as you punch in, everybody starts at you. Nurse! Nurse, help me! Nurse! Nurse, fix me! Nurse! Nurse, feed me! Turn me! Fix me! Help me! We are running around for the whole shift like one big kick to the world. Have a little suck of this! Have a little suck of this! It's good for you! Yeah. Why do you think they call it nursing? That's why they call it nursing. Now let me tell you, honey, there's a lot of those little suckers out there. Well, I do want to tell you just a few more things before you take off and go back to the real world. You should always have enough equipment. I'm going to show you my equipment in a little bit. But there's something that I need a little bit more than equipment. So I'm going to get ready and I'm going to tell you what I need.